let's all face it, being a Psych NP student and being a Psych NP new grad is extremely difficult. They throw so much information at us in thinking we're going to be able to just regurgitate the information and have all this information and be able to be successful as a Psych NP, as a new grad. But it's not the case. And they throw so many different books at us saying like, oh, you need this, you need that, you need this, you need that. This is absolutely necessary. This is absolutely necessary. And sooner or later, you come to find out that there are 20 different books that you have to have. But that's not the case. In this video, I want to go over 4 different products that were helpful, 4 or 5 different products that were helpful to be able to help me condense all that information, put it into something that you could read, and that's not so many thick books like this, and it's going to help you as a new grad and as a Psych NP student. So without further ado, let's go over this video. Welcome back to the channel, LifeofaPsychNP. If you are new to this channel, let me formally introduce myself. I'm Darty, the Psych NP, and in this channel I go over several different subjects to educate the public about mental health, ways to improve your lifestyle, topics related to nursing, nurse practitioners, and specifically psychiatric nurse practitioners like myself. So if you're interested in any of these topics, feel free to subscribe. Make sure you like this video because it helps me out so much, and follow me on Instagram at LifeofaPsychNP. So you probably clicked this video because you're interested in finding out what products are going to be helpful. Maybe not the absolute required products. I did make a video about the absolute required products. I'm definitely going to link it down below, and I'm going to put it somewhere up here, so definitely check that out after this video. But I wanted to make this video because there's, like I said, they throw so much information at you, and they throw so many different books that are required textbooks at you, but you don't know which one is going to be helpful or not. And yes, all those books may be helpful, and especially if you have all the time in the world to read it, which is just going to help perfect your craft. But there's certain things that we just want to be able to streamline. And as a new grad and as a student, I've done so much research just on things that maybe it's going to help me out, because yes, I've read those books, but it's so thick and so much to read that reading it over and over again, it's extremely difficult, and being able to kind of put all of those things into my head are extremely difficult. But I wish that there was just something that, a condensed version that they can show you, and it's going to be helpful. And I'm going to be going over those 5 products today because these have helped me out so much as a new grad, as a student, and even till this day it's still helpful. So without further ado, I know I already said that earlier, but let's get started. So the very first product that I highly recommend is the Psych NP E Binder, and I'm going to link that down below. You can purchase it at Etsy or at PayHip, but this is a comprehensive binder that's going to be going over everything. We've done a great job of being able to streamline it. Yes, I've helped create it, but we've done a great job of being able to streamline so much information and all the things that we need to know and learn and understand into a product that you can print out, or you'll be able to have at your desktop, and just being able to access it from anywhere. So we go over the psychiatric evaluation. So whether it's going to be the initial or the follow-up, we help you understand each section and why it's important, being able to give you a template and being able to help you put the information down into a condensed version so you'll know how to actually do initial evaluation. And it gives you helpful things like maybe a tip on how to ask this question, or maybe a certain way to get the certain answer, and it's going to be able to help you do so. And it's going to go over commonly used psychiatric diagnosis, the criteria. It goes over a checklist, ways to ask screener questions, so you'll be able to dive in a little bit deeper, or screener questions that you can ask, but if they are not pertinent, you can kind of just rule it out. So those are certain things that it's going to be absolutely helpful, especially as an NP student and as a NP new grad. We go over commonly used psychiatric medications. So we break that down. We break it down for adults, and then we break it down for children, adolescents, or pediatrics. And we're able to kind of show the main things that we absolutely need to know, whether they're sedative, or they have causing too much sedation, or if they're going to cause weight gain, if they're going to go over common side effects, starting dose, ending dose, whether they're capsule tablets. It goes over all of those things. And then it also goes over helpful psychiatric documents. So when I say helpful psychiatric documents, it goes over clinical practice documents. It goes over helpful psychiatry mnemonics to help diagnose those things, and going over these mnemonics so you know and understand, instead of having to know all of the criteria. If you understand the mnemonics, it's going to help you diagnose. It's going to be going over helpful therapeutic patient resources and handouts. So these are important because it'll help patients, especially as you're practicing. You'll be able to give these handouts to patients and they can understand it, whether it's a mood journal or whether it's going to be a list of ways for you to practice sleep hygiene, or maybe it's going to be something where they can help practice mindfulness or meditation, things like that. It's going to be able to help you, and you can just give it to the patients and they can implement it into their lives, because not only do we do the medication side of things, but there are certain things that we need to know and educate patients, and you can give them that handout, and this is in the ebook. And not only does it go over all of those things, but it also goes over neuropharmacology, to be able to kind of understand that and being able to go beyond just practicing. And not only is it helpful for practice and just kind of round out your practice, but it's also helpful when it comes to employment. It's going to go over ways to answer questions, what questions to ask employers, knowing the difference between 1099 versus W-2, or knowing the difference between coding, whether it's 99214 versus 99213, or 99204 versus 99203, or 90792 versus a 99204, or how to document 90833, which is the add-on therapy code, versus the 90836, which is another therapy code, but those differences between the two. And these are going to be helpful things because it's not only going to help you in practice, but it's also going to be able to help you while you're practicing, because you're going to understand how to document with these tips to code. So when, in case you do get audited, you'll be able to pass the audit with flying colors, because some people do get paid per patient, and if you get audited and you have to pay money back, that means more money coming out of your pocket instead of you gaining the money. So might as well learn these things now so you don't have to worry about that in the future. And this is important. And I am going to list this down below, and you'll notice there are going to be different links. There's going to be an Etsy link, and then there's going to be a PayHip link. So the difference between the two, they're exact same thing, but with the PayHip link, if you purchase it, it is a little bit more, but if you purchase it through PayHip, you'll notice that, like I said, it's a little bit more, but any updates that we make to the actual document itself, you're going to be able to get all of those updates for free, as opposed to Etsy. If we do have an updated one and you have the older version, then you're probably going to have to repay for that one also. So definitely something to think about. I would personally pay for the little bit more expensive one up front, just so I don't have to worry about having to rebuy it again in case there are any crucial updates. And we are coming out with an update soon, so definitely stay tuned for that one. And that's kind of where it is, and I think this document is extremely helpful. And if you look at Etsy, there's so many different reviews, and you'll see how it's going to be helpful for you overall. Even if you're a new grad or a student or even have experience, it's going to be helpful in some shape or form. So my second recommended product that you should have is the clinical laboratory medicine. So I say this is important because it's helpful, because some people that were only psych and not necessarily understood how labs work, or if they're rusty to it, then this is going to be helpful. Luckily, I have a background in ICU and ER, so having this understanding is helpful. But who knows, like, people being out of practice for so long, going over different labs and being able to interpret it can be difficult. So I definitely recommend this because it's going to break it down based off of every single thing. Like, so for example, here, uric acid test, and it gives you an explanation of the test, its relevance to psychiatry, preparation of the patients, indications, reference range, critical values, increased values, what's causing it, decreased levels, what's causing it, interfering factors, cross-reference. So this is absolutely helpful, especially when you're a new grad and not necessarily understanding why you ordered certain labs or why certain labs were ordered, and based off of that and how it's impacting based off of the psychiatry, whether you need to refer out or you need to get redone, or not necessarily have to worry because it's something that's normal, and that's going to be important. And all of these products I am going to link down below, so definitely check it out. Some of them may not be the most up-to-date ones that I'm showing actual in the products, but I'll try to update all the ones into the most up-to-date ones down below. So this third product that I highly recommend is Psych Meds Made Simple. So the reason why I recommend this book is because, one, it's very short, it's cheap, and it's absolutely helpful. Not only is it going to be helpful for you as a clinician, but it's also helpful for patients to understand how psych meds work. I always recommend this to my patients because a lot of times there's so much stigma associated with medications. They just think every medication is going to make them feel crazy. They're going to end up in the psych ward with the straitjackets and feeling like this, but that's not the case. And this is a good book because it gives you an explanation of how certain medications work. Especially, it doesn't go into detail like specific examples of all the medications one by one, but it breaks it down on like the common neurotransmitters and receptors, and then it goes over fundamentals, pharmacology fundamentals, and then it breaks it down by classifications, whether it's antidepressants, antipsychotics, mood stabilizers, goes over first and second gen antipsychotics. So it's definitely a book that if you're starting off and you want to get a good grasp of just like how medications work itself, and you don't necessarily want to dive in too deep into the Stalls book, but you want to be like, okay, this is how just the basics before you enter the program, or just to be able to talk about it in a way that patients are going to understand, then definitely have this book ready and maybe even lend it out to them. Let them read it, or let them buy it, or be able to just understand and like how and why they do what they do. And I think that's the most important thing at the end of the day. As long as you have a good, general, simple understanding of how the medications work, when you're able to educate the patients and telling them, oh, this is how it works, they're going to have a good grasp and actually buy into it. And at the end of the day, we're not necessarily salespeople, but we want to be able to dumb certain things down in order to help patients and understand how they do and what they do for why we're prescribing these medications. And this is a good one to help. So the fourth product that I highly recommend for Psych NP students and Psych NP new grads is Clinical Psychopharmacology Made Ridiculously Simple. So this isn't the most up-to-date one, but this is something that I've used from the very get-go till now. And the reason why I like this book so much is because it goes over pretty much everything, and it just dumbs it down. So it goes over general principles, depression, bipolar, anxiety, all the different disorders, and it gives you what to expect, certain symptoms, how you're going to be able to diagnose them, and then also goes over certain medications and goes over when you need to prescribe, although we kind of know, but at the same time it's still going to give that explanation. It goes over type of medications, generic names, brand names, what to look for, why you're choosing one medication over the other. It gives you decision trees. I don't know if you can see that, but yeah, it goes over so much. It's not going to tell you everything. It's not going to tell you like, oh, choose this medication because it's going to be better when it comes to SSRIs, but it'll give you a general understanding of maybe differences between the two, whether it's going to be Lexapro versus Zoloft, or whether it's going to be a TCA versus an SSRI. It'll give you understandings of side effects, and just so you have a general understanding, because you don't want to go into clinicals not even knowing and understanding how certain medications work. But if you read this book and have a good grasp of it, so when you go into practice as an NP student, if the preceptor or if your preceptor says something like, oh, why would I choose this medication over this, you'll have a good understanding. Or when you're looking through their charts, you'll have a good understanding why one medication may be prescribed versus some other medication. And it's just good having that basic understanding. Yes, you can go into further detail later on, but like I said, this is just the bare bones of understanding and gaining some sort of foundation, because you don't want to go into it reading all of these crazy books and just trying to regurgitate all this information and not really understanding what you read. But if you read something that just breaks it down in a simpler form, this is going to be something that's going to be like, okay, oh, this is why you did this, or oh, this is why I prescribed a certain medication in the manic episode versus a depressive episode, and based off of that decision tree, or being able to kind of look at, oh, this is the lab test that I need for patients when taking lithium, and this is what to look out for, and this will provide that. So definitely check this book out. So my fifth and final product that I recommend for Psych NP students and for Psych NP new grads is condensed psychopharmacology. And as you can tell, the common theme among all of these books are going to be about psych meds. So when you look at what we do, especially as a provider, as a psychiatric NP, and all the jobs that we're going to be applying to are medication management. Yes, there's going to be little things here and there that'll be able to sprinkle when it comes to psychotherapy or being able to kind of do supportive therapy, but this is kind of our bread and butter, and that's the reason why I want to recommend all of these things now. I am going to maybe come out with a part 2 of a video that I actually really recommend too, but I think this is going to be a good part 1 because these are the things that we absolutely need to know, or not absolutely, but I would highly recommend. And the reason why I recommend this book is because it pretty much goes over a lot of the medications that we do prescribe, and it puts it into a little book. So look how thin this book is, and this is good because it gives you an introduction. Like, I'm just going to read the back. So this is a 2016 pocket guide of psychiatric medications. Obviously there's a current up-to-date one, but this is the one I have, and I'll link down the most up-to-date one. So it functions as a quick reference for healthcare professionals and students who have involvement with psychiatric patients and their medication. I'm just going to skip certain parts. So it begins with a brief introduction of terminology, medication doses, psychiatric legal parameters, to black box warning, side effects, drug interactions, and most importantly, monitoring parameters. So this is a good book because it pretty much what I read, it goes over those things. And then it goes over like comparison charts. So it goes over different charts. Let me see if I can get it on there. So it'll go over comparison charts, and it'll just give you a good understanding. So when you do prescribe a certain medication, or if you do looking at certain things, you have a good understanding of what you can do and what are the parameters, and it's just a good visual representation. So if you are going to be pulling out a book in front of a patient, or if you are going to the side to look up something, it's just a quick reference book that you can just go to real fast and be like, okay, boom, 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 instead of going into a thick book like this. Look how thick it is, or going to Stahl's Essential Psychopharmacology. This is pretty thick, so it's just a good book that you can have if you are going into inpatient, or if you have a lab coat, or if you're in your backpack. You can just put this in your book, and then you can just reference it real quick. Like, oh, for example, what's something that I want to read? Let's just say, okay, so this one, specific target symptoms of schizophrenia. So there's positive, negative, cognitive symptoms. So it goes over those things, like positive, things that happen that should not happen, delusions, conceptual disorganization, excitement, suspiciousness, grandiosity, hostility, hallucinations, and then negative symptoms, which goes over the 5 A's, affect, so attention, anhedonia. So all those different things that it'll show you in here, and it's going to be helpful for you when your preceptor's like, oh, what's this? And then you can just look at it, oh, this is what it is, blah, blah, blah. This is the dosing per day. This is the brand name, dosage forms. And it'll show you exactly what you need to know in a very, very condensed book. Like I said, I am linking all of these books down below. These products are very, very helpful. These aren't the ones that you absolutely need to have, but I would highly, highly recommend it. And if you guys have any other books that I might have missed, definitely link them down below. If I were going to suggest another one, which I'm going to do in another video, definitely look at the psychiatric interview. So I think it's Carlotte, I want to say. But the psychiatric interview, that one's a key book, just because that one goes over basics of how to do the psychiatric evaluation, and it goes over certain questions, certain ways. It gives you tips on how to interview certain personalities, or how to interview adolescents, how to interview parents, geriatrics, and based off of the setting, it goes over all of those things. Let me look up the book. So psychiatric evaluation, I'm pretty sure it's Carlotte. Is it Carlotte? Psychiatric, it's called the psychiatric interview, but anyways, the psychiatric, I don't know why I can't even think of the name. I don't have it with me. I couldn't find it in my book. Yeah, so it's Daniel Carlot's Psychiatric Interview. I'll link it down below. Definitely is a good book to have because it's going to help out so much, especially with a psychiatric interview and just being able to be comfortable. And like I said, medication management is a huge component of what we do, but interviewing is a huge component because that's an art form. Not only is it an art form being able to interview and being able to get as much information in a short period of time to be able to diagnose, but then also being able to understand medications, how they work, and then being able to kind of manipulate it or being able to take the medication and form it and put into a little package for our patient for them to be compliant and starting to feel better. So both art forms, and I think these are certain things that I absolutely would recommend. Like I said, put a link down below for all of these products, and if you have any questions or things that were successful for you, link it down below. I am not sponsored by any of these people, nothing like that, so it's not like I'm gonna be doing anything. I am gonna put a Amazon Associates link down below, so definitely yeah, just do it. So I'll put all the links down below, and if you have any questions, let me know. And as always, have a wonderful day. Bye.